So thank you very much for inviting me to speak on strategies to cope with psychological impact of medical errors. I work closely with the ICU staff, and I appreciate actually how challenging and rewarding their work is. They work with the most difficult situations, the highest acuity, complex cases. Their patients are really life and death matters. They use extensive technology, probably the most extensive technology within our hospital system. And recently, they've also been affected by COVID-19. There's been just a tremendous demand on healthcare needs within the ICU departments. We've had large volumes. They've had to work in surge spaces, areas that they're not usually used to working in, areas where they don't have all of their equipment, large transfer numbers, colleagues being redeployed, even sickness and sometimes the loss of colleagues who have actually contracted COVID-19. So a very stressful environment, which I'm sure all of you have actually shared around the world. So it just illustrates the point that we're all professionals, but we're also human. And it's really important for us to remember that as humans, we have our own needs, and we've got stresses in our own professional lives and personal lives. We might have some physical problems ourselves or mental health issues we're dealing with. Working in a really high stress environment, again, the psychological needs come up. We've also been faced with a lot of other outside influences. We've had protests, we've had verbal and physical abuse within the work environment, and people have been working very long hours, sometimes not having time to hydrate, sleeping very short time periods because of the demands of the shifts that they're working. And what happens is that all of this overall functioning can possibly have an impact on errors. So what we know about the ICU environment, we're really testing the limits out there, but we need to understand how vulnerable we are. And we're imperfect. We try our best. We walk in each day. We try to do the best that we can to help individuals, but sometimes errors occur. And it's important to really foster an environment where people feel safe, where they have an opportunity to speak about their issues, to speak about their insecurities or the challenges that they're facing prior to ever a medical error occurring. So we need to have like a true dialogue and listen to our colleagues and work together prior to us having to face a really highly charged emotional event, which is really related to either a medical error or the death of a patient. So what happens? We know when an error occurs, the person behind the mask suffers a lot. We blame ourselves. We can be very anxious, depressed. We've even seen in the news about physicians who've actually committed suicide, nursing staff who have actually done the same. We can feel very incompetent. We can feel like an imposter. We feel like we don't deserve the esteem of our colleagues and our patients, and that we're really not doing a great job. And this can actually lead to an existential crisis where we actually question who we are. What are we doing? Is our entire career defined by this one moment, by this one error? We often feel alone, and we need to really allow our colleagues to help us. But we've also been trained that, physicians and nursing staff and allied health and pharmacists and social, we're all very resilient and we don't have these problems. And so therefore we often don't reach out. So there has been a bit of work done in medical errors and it being a traumatizing experience by Dr. Laurent. And as you can see here, he interviewed 20 ICU nurses and 20 ICU physicians, large percentages of distress. And what happens is that we start to second guess ourselves. We become hypervigilant. We check things over and over again, and it can actually paralyze us. And we can't actually make decisions. And when we can't act, and in an ICU environment, we've got to really act very quickly. We might actually start making more errors than we would have if we had not had this prior experience. So we need to be on the lookout for the fact that our colleagues burn out. And unfortunately, sometimes people will even leave the profession because of the stress. So really important to have a supportive and safe environment. We need to reassure them that we value them, both as colleagues and friends, and also to involve family, because family is an important aspect. Family often values the fact that they're working in the healthcare system and helping others. And we need to have a spirit of inquiry, not a spirit of blame, but we need to think about basically trying to see how we can access supports for these individuals. If they need mental health support, let's try and allow them to access that. Let's try and see whether we can actually provide support both within the ICU environment and outside of the ICU environment, and not to stigmatize people for actually seeking support. So the best way to approach a medical error, if this has occurred, is to communicate with the patient and the family. We need to have an opportunity to express regret that this has actually occurred. We often know that there's been breakdowns at multiple levels. When medical errors occur, the events are usually multifactorial. They're not related to one specific individual. It's not one individual who's oftentimes been the cause of the medical error. And if you sometimes start blaming yourself and accepting it all as your fault when it's not reflective of the events, it can be extremely psychologically harming. So one of the tools that's very helpful are critical incident debriefs and root cause analysis. And oftentimes these are basically faced by trepidation by most staff, but it's really to explore what happened. What were the sequence of events that led to this? Where did the safeguards actually fail? And it helps us all understand our own role and what happened during that time period. And it's important to kind of think about the team, because we work in teams, we have a lot of support, and we actually form excellent groups of people who work to help the patient. But sometimes some of these safety measures fail, and it has to do with the collective team critical thinking. And critical incident debriefs and root cause analysis are one of the few opportunities that we have to talk about our teams and our work within our teams. And so we can actually learn, so that we can actually explore what the critical thinking is, and really realize that there's a lot of uncertainty in decision making in the medical fields. So in summary, I'd say that the coping strategies that we use are going to have a large impact on others. It's going to have an impact on us, but it's also going to impact our patients if we can't make decisions, if we're paralyzed in terms of moving forward. It's going to affect our colleagues and our family. It can have long-term effects, resulting in burnout and losing people to the profession. And dialogue and discourse are probably the most important things in terms of recovery from medical error. And always important to know that you are not alone. I want to thank you for your attention and time. And I also want to thank Dr. Laura Haralick, who really spearheaded the journal article that we wrote, and for all of her support. Thank you.